Treating anemia depends on the underlying cause of why you have anemia in the first place. And probably the most common type of anemia is iron deficiency anemia. Iron deficiency anemia is typically caused by three things. Firstly, if you're not absorbing iron efficiently. If you're not absorbing iron efficiently, then you're not going to have enough stores to make red blood cells, and that's going to lead to anemia. Another reason for iron deficiency is a diet that is deficient in iron. So if you're not taking in enough iron in your diet, your absorption may be great, but if there's nothing to absorb in the first place, then again your iron stores will be too low. And third is if you are losing blood. So one of the most common reasons why women will have iron deficiency anemia is because of heavy periods. So treating iron deficiency anemia needs to address the reason why you are iron deficient in the first place. So if it's because you're having an iron deficient diet, then increase the amount of iron that you are eating. Iron-rich foods can come from animal and plant-based sources. Animal-based sources of iron will have heme iron, and they'll come from things like meat, liver, and poultry. Plant-based iron is non-heme iron. It's found in green leafy vegetables like spinach. It's found in lentils and tofu. And then it's important to also increase the amount of vitamin C rich foods that you're taking with your iron rich foods as well, because vitamin C helps to absorb iron. This is especially important if you are relying solely or predominantly on plant-based iron sources. So including foods that are rich in vitamin C like citrus, strawberries, bell peppers will help to improve your iron absorption. Next, it's also important to address heavy bleeding, and this is super important when it comes to your period. So if you're having a very heavy period, you need to discuss with your doctor about why this may be the case. Is it fibroids? Is it an estrogen dominance? Is it endometriosis? Is it polyps? Why are you having such heavy bleeding, so that you can address the cause of the bleeding and reduce the amount of blood loss through your period. And then focusing on your gut health is going to be important as well, because if your gut is inflamed, then you may not be absorbing iron efficiently. And then also iron supplementation is another option to increase your iron levels. In severe iron deficiency, iron infusions may be necessary. And it's also important to remember that when you are using iron supplements, that you avoid drinking tea or coffee with your iron supplements, because this may affect absorption. Another way to increase the amount of iron in your diet is to cook with cast iron pots and pans. A deficiency in vitamin B12 or folate can also lead to anemia. Vitamin B12 deficiency can occur if you are not taking in enough foods that are rich in vitamin B12, or it can also happen if you are not absorbing B12 efficiently as well. This is known as pernicious anemia. So you can treat a vitamin B12 deficiency with vitamin B12 injections, as well as increasing the amount of vitamin B12 rich foods. So eggs, dairy, and fish, or veg options like tempeh, chlorella, and nutritional yeast. Folate deficiency can occur during pregnancy, or it may occur because you're not eating enough folate-rich foods. So you can supplement with folate, and you can also increase the amount of folate-rich food. So again, green leafy vegetables are high in folate, as well as beans and citrus fruits. Chronic conditions like kidney disease, cancer, and even inflammatory conditions can all lead to anemia. This is known as anemia of chronic disease. So addressing the underlying chronic illness is going to be super important in order to address the anemia.